Of Alabama is well into its next surge of COVID-19 with cases and hospitalizations ramping up. Here in the Wiregrass, those numbers are at levels not seen since the beginning of this year. WDHN's Alex Valdez explains why the increase of cases is causing worry among medical professionals on the front line.
And even though these numbers aren't the highest we have seen, medical experts say the amount of COVID in the community is still high enough to cause some worry, especially if you aren't protected and staying cautious. At this time, the state is averaging around 2,000 positive COVID cases a day, when in early April, Alabama saw some of the lowest numbers of COVID the state has ever seen, reporting around 100 cases a day. But now experts say the state is well into our next COVID surge.
We are very much assuming that this is an undercount in the actual number of cases, but it does give us an idea of a trend. And what we can tell is that COVID is just more active.
And it's not just cases. Hospitalizations statewide have also seen a spike, with 517 patients in Alabama hospitals battling the virus. Locally, those hospitalizations are also increasing, with Southeast Health now treating 38 COVID patients, and Flowers Hospital, that in early March was treating no COVID patients, is now treating 8. And to help combat the surge of COVID-19, experts are discussing a potential new booster that could be out by the fall and offer better protection against Omicron.
What I would suggest is that if people need a booster, it's time for your booster, go ahead and get it. Don't wait until this comes out. It could be October or November before we see these hit the market.
He adds any Alabamians living in a county that is considered high risk for the spread of COVID-19 should consider masking up and testing whenever feeling sick. He says the earlier the virus is caught, the easier it is to manage, since there are multiple treatments available.
COVID activity is up. People are going to the hospital. People are dying. People are sick with COVID, and it is still a serious disease. Even though it's on average not as serious as some of the earlier strains, it is still serious.
And as the state continues to battle this current surge of COVID-19, medical experts want to remind Alabamians the importance of knowing how to stay protected. Reporting in Dothan, Alex Valdez, WDHN News for the Wiregrass.